Today I will be discussing about hepatitis B and C. Hepatitis B and C is a disease caused by infection with a virus. Chronic, that is lifelong infection with HBV, HCV can lead to liver cirrhosis, liver failure and liver cancer. Hepatitis B and C is transmitted through contact with infectious blood or body fluids, examples like semen, saliva, including injection drug use that involves sharing of needles, syringes or drug preparation equipment. And it can be spread through contact with blood or open source of an infected person. And it can also spread by sharing items such as razors or toothbrushes with an infected person. And it can be transmitted by the birth to an infected mother, and it also can be transmitted by sex with an infected partner. B and C affects your liver. If not treated in time, it damages the liver to an irreparable extent, and it may lead to liver fibrosis, cirrhosis, cancer of liver cells and even death. The following populations are at risk of becoming infected with hepatitis B and hepatitis C virus. These are infants born to infected mothers, sex partners of infected persons, injection drug users, household contact of persons with chronic hepatitis B infection, and healthcare and public safety workers at risk for occupational exposure to blood or blood contaminated body fluids, and hemodialysis patients. These are the people who are at risk for acquiring hepatitis B infection. Symptoms of hepatitis vary a great deal. A large number of people have no symptoms at all, while others have severe symptoms. Early signs are similar to the flu, like general fatigue, joint and muscle pains, and a loss of appetite, nausea, vomiting and diarrhea or constipation may follow with a low-grade fever. As the disease progresses and jaundice, yellow skin may occur. It is important to remember that even mild forms of the disease can lead to serious complications. Simple blood tests are necessary to determine with certainty if you have hepatitis. The basic precautions one can take to prevent hepatitis B is have safe sex, avoid sharing of needles, toothbrushes, razors, etc. And healthcare workers are at increased risk. Therefore, they should take adequate precautions. For example, they should wear latex gloves if there is any risk of coming contact with the blood or other body fluids, and they can take vaccine to prevent hepatitis B. And hemodialysis patients should go in for blood tests for hepatitis regularly, and young children should be vaccinated against hepatitis B. Yes, hepatitis B vaccines are available in the market, so you can protect against hepatitis B by vaccination. Unfortunately, if you are already infected, then you cannot be protected by vaccination. And hepatitis C vaccine is not available, so there is no protection against hepatitis C. Only precaution to be taken care. For an acute infection, there is generally no treatment other than rest and supportive measures to manage any symptoms. For chronic hepatitis B, there are several drugs available which slow down the virus and reduce the liver damage. In few cases, they may even get rid of virus completely. The hepatitis C virus can be cured if the virus remains cleared from your blood at 6 months mark after treatment as finished. This is called a sustained virological response, that is SVR, and data tells approximately 80% patients achieved SVR in genotype 2 and 3 and 55% in genotype 1 and 4. HCV positive persons should be advised to avoid alcohol because it can accelerate cirrhosis and end-stage liver disease. Viral hepatitis patients should also check with a health professional before taking any new prescription pills, over-the-counter drugs such as non-aspirin pain relievers or supplements, as these can potentially damage the liver. Persons should not be excluded from work, school, play, child care or other settings on the basis of their HBV-HCV infection status. There is no evidence of HBV-HCV transmission from food handlers, teachers or other service providers in the absence of blood-to-blood contact.